Hello, my name is Yann Vanneau. I'm working in Georges Pompidou European Hospital in Paris, France. I presented data on the Nivorem ancillary program trial. The Nivorem trial is evaluating nivolumab in metastatic clear cell renal cell carcinoma in a real-world setting in France. We included 700 patients in 26 centers, and the clinical results were presented last year at GU ASCO. This year I have presented data on biomarker study. We try to answer the question of which is the best biomarker to predict response to nivolumab. So we launched a translational program. We select all FFPE samples with immunohistochemistry, and we evaluated some immune markers, 14 population, immune cells, PBRM1, BAP1, checkpoint molecules, and we evaluated all these markers and correlated with outcome. Our main findings is that PD-1 is associated with a better progression-free survival, and we did not find any significant association with overall survival, first of all. Then other checkpoint molecules, TIM3 and LAG3, were not significantly associated with PFS or OS, even if LAG3 tend to be associated with a worse outcome. We looked at PBRM1, which is lost, protein is lost in 15% of the case, and we found a better overall survival in case of loss of protein, and we found a trend for better progression-free survival also. The last markers we evaluated, AXL, which is an epithelial to mesenchymal transition marker, and AXL was associated with worse progression-free survival. So with these three markers, we can predict a response, survival or PFS to nivolumab in this big phase 2 cohort. These markers are not used in the clinics right now, but we can imagine that we can do it in the near future very simply, and probably we have to combine of these markers to more accurate predict a response to nivolumab. These markers are quite simple to measure by immunohistochemistry, but we didn't do it in routine. So we have to standardize. We know with PD-L1, which everybody knows that we have to standardize the antibody, we have to standardize the cutoff and the cells evaluated. But if we have a strong impact on the outcomes, I think if we can validate that, I think we can move to the standardization and to use it in the clinics. We have some centers in France that already use some of these markers. PBRM1 is one of the markers frequently assessed in the routine in the clinic.